All right, so if I could have your full name, please.
Stephen Edward Amsden.
Where were you born and raised?
Born in Providence, Rhode Island, 1959, and raised in southern central New Hampshire through 1977.
And where did you move after New Hampshire?
Hartford, Connecticut.
Do you have any children?
Yes, 2 daughters.
When did you find out you had Lyme disease?
January 10th, 2009.
That's an approximate date.
Approximate.
Do you still have the infection?
It's unknown. It's too early to tell. I have discontinued antibiotics after 44 months as of November of last year, so it's been 3 months.
And how do you feel so far?
I'm still struggling.
What are you struggling with the most?
The primary symptoms that still seem to be prevalent are fatigue and widespread pain. The neurological and psychological issues seem to be vanished. They're gone. So it's a little too early to tell. I've only stopped taking supplemental medication for the last 3 weeks. And it's my understanding that it'll be some time before I'll actually be free of the influence of those meds as well. So it's just too early to say. I don't know yet.
How long would you say you've had it for?
Since 1974.
Is that when you got the first tick bite?
I don't know if it was a tick bite, although it probably was. There was nothing like a rash or anything that precluded it. It was a series of tick bites later on in the 90s that probably reintroduced a new form of the infection. So there was that period in the 1990s. Yes, there were ample opportunities to be bitten by ticks, and the likelihood of transferring the illness during that time would be very high.
So where were you when you got that first tick bite?
Well, the tick bite or not, I'm not sure, but the first incident in 1974 was upon returning from vacationing in Cape Cod, Massachusetts, which we, as our family, did every year for about 20 years, starting in 1970.
How did you feel when you found out you had Lyme?
A tremendous sense of shock and of relief at the same time. Shock.
It pretty much explained your symptoms. You finally knew.
Right, knowing what it was a great revelation, and at first gave me great hope, thinking that, we now know what it is, now I can do something about it, until I learned what I was really in for.
Did anybody know that you had Lyme disease at that point? Did you tell anybody?
Well, when I found out, other than my immediate family and a few close friends, that's the only contact I had with society to begin with. So it wasn't like I was shouting it from the rooftops. There were only a few people who were really involved in my life at that time.
How did other people react when you told them or they found out that you had Lyme disease?
Perhaps mostly disbelief.
Why do you think?
Because it's not a visible condition to most people. It's mostly a disease of the inside. It's not something that manifests physically or externally, only in the most severe symptoms. So, yeah, that's why.
Kind of hard to believe that you have something when you can't really see it.
Right. There's a tendency for people to think that you're a hypochondriac, that a malingerer, inexplicable psychological behavior that's inexplainable. A lot of people will look at it that way.
Did you know about Lyme before finding out you had it?
Yes, I had been tested twice before and had come back with negative results. And of course, knowing now, looking back, of course, those test results were highly unreliable and could even be completely in error. So the third test proved positive.
What kind of misdiagnosis or diagnosis did you get from different doctors until you got to Lyme?
Well, the first one was in 1974. Upon returning from our vacation in Cape Cod, Massachusetts, while weeding in the garden, nice hot summer day, July, I stood up and saw an orb underneath the tree about the size of a beach ball, and it had light, all the colors of the light of the rainbow, shimmering, undulating, changing, and it appeared to be the presence of some type of superior intelligence, perhaps an angel, and it floated across the driveway up over the house, and when I saw it go, I fell back into a grand mal seizure. From that, I was diagnosed with epilepsy, first in 1974. That was the first misdiagnosis. It went on from there into my early adulthood, coming through in terms of psychiatric manifestation. So early on, there were psychiatrists involved. There were various other specialists who looked at, again, mostly from the psychiatric. There was fatigue, then there was unexplained pain. This eventually came on to not only the misdiagnosis of the depression and bipolar, but rheumatoid arthritis, and then finally fibromyalgia, which is like a combination of all of the above. But then there were a number of neurological and psychological disorders, anywhere from something like Tourette's syndrome to memory, cognition problems. ADHD was another one.
Pretty much everything in the book they threw at you.
Yeah, they ran out of things to diagnose me with, and they ran out of medications to prescribe me. So they basically gave up. And it was at this point of having the borderline personality disorder and dementia. Things were getting a lot worse. Is at that point where I was cornered for the third time to get the test. I'd already been tested twice before with negative results, and I fought my mother at 49 years old, saying, I don't have Lyme. I have fibromyalgia. I was comfortable with that diagnosis. And I didn't have the strength, though, to battle with my mother, so I acquiesced. got the third test, and it came back positive for old Lyme.
What kind of symptoms did you normally get while having Lyme?
Well, in the beginning, it was the neurological issues with like a petit mal epilepsy, where there would be this kind of jerking movement that would occur frequently, to the point of every 5 seconds, and sometimes multiple times. And but I was young and still pretty strong and healthy otherwise, so I tolerated it well. And one of the other things was sensitivity to light. I found it to be bright outside. I was constantly wearing sunglasses. And aside from the psychological and psychiatric type issues dealing with self-esteem and bipolar depression, but besides those, I could have easily been misdiagnosed for MS, where the muscles in the back of my legs were not working right. They were convulsing, sending convulsions or seizures to my head. The other symptoms circulate around widespread pain, mostly joint pain in my arms, hands, wrists, fingers, knuckles. A profound fatigue, just a weakness where it made it difficult to get out of bed. Couldn't do anything. And a type of dementia where the faculties that we normally consider ourselves, that make us human, like will, reason, the emotions, those are gone. Just not there anymore. You start to question whether you are really even human anymore. So there could have been a number of other misdiagnoses. I could have had Parkinson's due to the tremors that I was having. I was misdiagnosed ADHD, unable to focus, to concentrate, couldn't read anymore. So the psychiatric issues, the widespread pain, the fatigue, and a crippling anxiety, a fight or flight syndrome that was overpowering, and the feeling of being slowly suffocated, like I was drowning, couldn't get enough air. Those four things, the psychiatric, widespread pain, anxiety, and chronic fatigue, those are the four pillars for most of the manifestations of Lyme.
So pretty much you were having you were having issues, physically, mentally, you name it.
Yeah, it was pretty much involved everything at that point. And there could be multiple symptoms ranging from one side to the other, depending on which day. There was no rhyme nor reason to it. There was no pattern. There was nothing that I could associate with what was going on that would cause this kind of thing. It seemed to be totally random.
I'm sure it felt you felt very desperate to just get rid of this, whatever it was.
Yeah, you reach a point of desperation, and then you go beyond that.
What would you say was the hardest part of living with Lyme, living with all of this?
The hardest part is being cut off from humanity. Being in a state of solitary confinement, and this feeling that you just don't belong. You do not belong, period. That's the hardest part. It's like being trapped inside a dirty terrarium that you can't get out of, and you're watching life go on outside of it, and you're stuck on the inside.
Completely alienated.
Alienated, and the dementia. The dementia part of this is definitely the worst. The worst.
It's very interesting how Lyme can affect people in so many different ways. Some people it can be very mainly physical symptoms, and with other people it can be neurological,
Exactly.
psychological.
Right.
Very interesting.
Yeah.
What would you say is necessary in order to be able to work and deal and cure Lyme disease? When it comes to, because Lyme is not covered by health insurance, pretty much by most of them, and most doctors won't touch it, won't touch a Lyme patient. How were you able to handle that? How were you able to, what kind of help did you receive? Where did you go
to? Well, in order to combat the disease, it's necessary for a long-term protocol of powerful antibiotics. This has been the best choice for combating the disease, and has demonstrated being effective in terms of improving overall the Lyme patients' abilities and their ability to enjoy life, the quality of life. So you have to find a Lyme literate doctor who is capable and willing to administer long-term antibiotic protocol, not just for a period of days or weeks, but months and possibly years. So finding a Lyme literate doctor, number one, but finding one who is essentially going to see you through to the finish line, that's essential.
Yeah, because a lot of doctors will just sometimes stop halfway. It's like, oh, you're done. You're cured. You don't need anything else. And I mean, it's a doctor, so you kind of feel like you're supposed to listen to them because they're a doctor. They're supposed to know more than you, right?
Yes, but the length of time it takes for recovery can easily lead one to believe that the protocol is not working. And this is the counterintuitive part of treatment, is that typically you would think that with a long-term antibiotic protocol that you would start to feel better, but it's not the case. In actuality, you feel much worse due to the die-off of the bacteria, leaving behind toxins which cause inflammation throughout the body. So it's a fairly miserable process of recovery. And probably the number one reason that people relapse is that their doctors do not prescribe a long enough course of antibiotics to make it to the finish line. But the other side of that coin is that the patient often is unable to endure the side effects of recovery. They are so severe. So there's two things going against you, even if you, number one, know that you have the disease. Number two, you have to find a doctor who knows about it. Number three, a doctor who knows about it, who is going to put you on it long enough to get you there. And number four, you have to be a patient who is resilient and persistent, consistent, and unfaltering in your application of that antibiotic protocol. There's a lot going against someone who has it.
Yeah. like a type of cancer.
It's similar in some ways. There are many people who have Lyme who would gladly trade it for almost any other type of cancer. As a matter of fact, there was one Lyme patient who was excited at the knowledge that she had cancer because she thought that finally she was going to get the protocol that would get rid of the Lyme.
What's the best way that you feel it is to get rid of Lyme, to be able to get treated and get rid of Lyme? What do you need to do that?
Well, in order to optimize your chances of survival, it could be necessary that you have a caretaker, an advocate, and a Lyme literate doctor. The caretaker being that if you are in a situation where the symptoms are so severe that you are unable to work, and in my case I was unable to do anything. It's kind of paralysis. Then the caretaker role may have to be taken by someone else. If you cannot care for yourself during that time, yes, it's going to increase your chances or your probability of surviving or getting rid of the disease if you have a caretaker. Now, if you have an advocate, that's someone who will look after your affairs, make sure that you get to the doctor on time, that you're going to be able to afford to perhaps live while not working. You have bills to pay. There's a lot of expenses involved. So how does one afford the treatment when you are unable to work? Well, that's the advocacy. An advocate is someone who is going to basically provide financial assistance and otherwise other physical means of getting you through this time, be it the weeks, months, or years that it might take.
There's a lot of people that it's very hard for them to find those types of aids, that type of help.
That's right. There's only going to be a small percentage of people who have the good fortune to be in that situation where they have a caretaker and an advocate. It may be necessary in order to beat the disease, and if you don't have that, well, that certainly decreases your probability of getting to the finish line.
And unfortunately, some people don't get to the finish line.
Unfortunately, most won't.
Yeah. Wow. So, why do you think it is so hard to get rid of this?
Probably because it goes undetected for so long. It often starts off with very mild symptoms early on that can persist for years before getting worse, or you may be administered other medications that suppress the symptoms that allow it to continue to fester and to permeate your body. And a lot of your own defense mechanisms, just as a human being, will help compensate for detriment from either the psychological effects. You may find ways of dealing with that, and the psychiatric medication certainly suppresses the symptoms. And meanwhile, the symptoms are being suppressed, but the source of the disease is flourishing. And until you're at a point where you're in a crisis situation and everything you've done before doesn't work anymore, and if you suddenly find yourself where you're unable to cope with your existing situation, yeah,
Get pretty dicey.
indeed. What I've noticed the most in coming out of this debacle is in looking around and the awareness of how widespread this disease is and to what extent. There is a whole generation of children being born with the disease to mothers who unknowingly carry the infection. Now, how many generations will it be if this goes undetected before we as a species will be unable to produce viable offspring? So that alone is essential that we come up with some answers, and quickly. Now, that's one of the more disturbing realizations in coming out of this, is how widespread it is, and these young mothers who are unknowingly passing the disease to their unborn child. So just say, for instance, for the sake of this example, that 1 out of 10 people end up having the disease. Of those 1 out of 10, you put all those people in that group, and 1 out of 10 of that group will actually find a Lyme literate doctor who can deal with their situation. So you take the 1 out of 10 from that group, you have a new group. Now this group, 1 out of 10 of those will actually stay with a protocol long enough to make a meaningful difference. And out of those people who can make the meaningful difference, 1 out of 10 of them will actually make it to the finish line due to their own resilience and perseverance. So the chances of recovering, or the probability of recovering, are very small. The 1 out of 10, 1 out of 10, 1 out of 10. I mean, it just gets to a smaller and smaller group of people who actually have a chance of making it. And this is what I would call the chosen ones. The chosen ones, for whatever reason, be it their own genetic disposition, the absolute just plain dumb luck of finding out that you've got it, and not something else, finding a doctor who can treat it and will treat you long enough, and if they're willing to treat you long enough, can you stand the severity of the symptoms of treatment long enough? So it's up to the doctor, but it's up to you ultimately as the patient, whether you have the resilience to get far enough. It's kind of like being stuck in a swamp. If you do nothing, you go no further, you sink. Once you start through that swamp, don't stop. You're taking an antibiotic protocol that is propelling you through the swamp, you keep going, no matter how long it takes. It's different for everybody. It could be weeks for some, months for another, years for some. Depends on how long you've had it, what you've had, the number of co-infections you may have with it. But you do not stop once you make that journey until you get to the other side. And it is very Darwinian. There's only going to be a few who are going to survive.
A lot of variables.
Absolutely.
And also the advocate. Being able to have an advocate to advocate, caretakers, somebody to keep you on that path.
Right.
Because when you're in that type of situation,
you can't do it on your own.
yeah, it's like expecting a drug addict to get out of the drugs by himself. It just doesn't
That's
happen.
right. It's where it was an intervention. I was 49 years old, and my mother had to intervene on my behalf because I was unable to. Who else was going to? There was nobody else.
Are there any other people that you know of that have Lyme that are close to you?
Yes. Yes. My youngest daughter, Leah. My youngest brother, Randall. My father had babesia last summer. Has been bitten numerous times. He's a land surveyor, has been for 50 years. How can he not have it? It's almost impossible not to get it in our situation. Some of the myths about it being hard to catch and easy to cure is utter nonsense. It's been proved over and over. There is so much anecdotal evidence to the contrary. It's easy to get, and it's hard to get rid of. These are two of the myths that have been propagated for years, and why they still have any credibility, or do they? It's beyond me.
So the family members close to you that have Lyme, how are they doing?
Leah has made the crossed the finish line, and is in the period now of the wait and see period where you see if there's going to be any relapse, or time will tell. There's only so much you can do but wait and see. And my youngest brother, Randall, he has prevailed on Social Security disability. He is completely disabled. He's been on and off protocols now for several years, and is still very much afflicted and very much struggling with the disease.
Why do you think it's been so hard for him to have it treated, to overcome it?
The same reason of it taking so long to be diagnosed. He's probably had it for 20 years or more. And of course, we're led to believe it was because of this or that or anything except what it was. So by the times you're completely disabled, it becomes almost impossible to get rid of it. Although most everybody shows remarkable improvement, there's still only a few who are actually going to make it through across the finish line. So, yeah.
If I had Lyme, I hope that I don't, what would be your best advice for me to be able to overcome?
Find out whether you have it or not. If everybody made that choice, everybody should find out whether they're a carrier. If there's something you can do about it now before it becomes a crippling affliction, then there may be a chance of avoiding the labyrinth that the rest of us have fallen into and find it so hard to get out of. So certainly finding out now before the symptoms become so prevalent that you're looking for any answer. And when you're driven by desperation, you're more apt to accept the wrong conclusion, the wrong diagnosis. So calmly going about finding out for sure whether those pains in your muscles and joints, is it just getting older, as I was told for years, or is there actually something there? Well, it may be so mild that it's not preventing you from going to work, from thinking or doing or whatever it is. But certainly finding out to be sure now before it gets you later, that's probably the best thing we can do as a species and a society where we impact each other. So awareness, and then the desire to find out for sure whether you are a carrier. That's probably the best thing that you can do for yourself and for your loved ones and for society in general. Yeah, the difficulty with the testing to nail down whether for sure it's the case with you or not, that is a big issue. The current standards for testing in labs like LabCorp and Quest and your common labs have a dreadful failure rate of false negatives, where you could be tested for it, it comes back negative, and yet you find out down the road that, oh no, you have full-blown Lyme. Well, why didn't they catch it 3 years ago when you first got tested? Well, the tests are notably erroneous. And aside from one lab in California, Palo Alto, called IGeneX, they use a combination of tests that have a 95% accuracy rate. It was not until I got tested through IGeneX, it was then that I learned that, in fact, I did have the Lyme that I had tested twice for before and had come back negative. So those negative test results propelled me for another 7 or 8 years of further becoming infected and thinking that all the while that, well, it can't be Lyme. I've been tested. It was negative. It's just not the case. If you test negative, it does not mean you do not have Lyme. So when you decide to find out, use IGeneX. You want to find out, if you're going to find out, you want to find out for sure. You don't want to use these labs which 2 out of 3 are coming back with the wrong results. It's not that it won't help you, it's even worse than that. It's going to make things so much worse. So that's the thing about the testing. IGeneX. There are tests that are coming out now that are supposedly more accurate. It will come, but don't wait until then. The time to find out is now.